We're going to go ahead and get started. Welcome again, everyone, to our November 19th Inland Coalition on Aging meeting. My name is Carmen Estrada. I'm the Executive Director of Inland Caregiver Resource Center, as well as the Inland Coalition on Aging Treasurer and co-chair of the Inland Empire Master Plan on Aging Advisory Committee. Thank you all for joining us. For those of you who is the first time being here, welcome. Please, if you can, in the chat, write who you are and what organization you're with. We unfortunately don't have time to do introductions for everyone, but if you can do that, that would be great. So today's agenda, we're going to talk about some key points from the last meeting. We'll provide you with some IEMPA updates on the process. And then we have a presentation on caregiving and Alzheimer's and all other dementias that will be conducted by myself and Susan Howland from the Alzheimer's Association. Some of you may or may not be aware, but November is National Family Caregiver Month as well as Alzheimer's Awareness Month. So in honor of that, we wanted to present to you some information on caregiving and Alzheimer's, and then also related to how we're including it in the development of our master plan for aging. So next slide, please. Some key points from the last meeting, and we hope Ben joins us here shortly. But key points from the last meeting, we had a great presentation from Maria Colina, the Executive Director of the California Collaborative for Long-Term Services and Supports, where we discussed California's aging and disability landscape. She also went over what are long-term services and supports, as well as systems changes that are and efforts that are underway. If you missed the last meeting, we do have recordings of all of our meetings on the inlandaging.org website. So if you missed the last meeting, we have the slides there for you and the recording of the presentation by Maria Colina. Excuse me, I have a little cold today. All right, so I'm sorry about that. I'll provide some updates on the master plan for aging. Sorry. I wasn't coughing all morning until now. Right, so quickly, some updates. We are in the need of agency partners to implement the master plan. If you are interested in collaborating with us, please send us an email to info@inlandaging.com so we can schedule a meeting with you. We're looking for partners in transportation, housing, behavioral health, and social supports, as well as caregiving, Alzheimer's, and other dementias. So we're pretty much done putting together the master plan, but we want to include in the plan agencies that we're going to be collaborating with to implement the plan. So once again, the plan that we're creating, we don't want it just to be a standalone project, something that sits on the shelf. We want it to be an active plan, but we need your help to implement it. So please, if you're interested in learning how you can help us, send us an email at info@inlandaging.com. The outreach that we completed so far for the Inland Empire Master Plan of Aging, we did a presentation on November 14th, where we presented to the AAA Council of California. We also have an upcoming meeting on the 21st to meet with San Bernardino County Public Authority. So they've already reached out as being interested in collaborating with us to implement the plan. So please, if you are interested in helping us out, send us that email. Coming up next week, we did change the coalition meeting to today because we know that a lot of people might be off next week for the Thanksgiving holiday. However, we will still be having our community awareness live stream. We have these once a month on the fourth Tuesday of every month. And so the next one will be next Tuesday at 10. It will be on our YouTube channel. You're welcome to participate and join and listen in, where we'll be also discussing caregiving, Alzheimer's, and other dementias. And we will have a special guest from SHIELD talk about how they plan to help us in implementing the master plan for aging. Right. So next slide, please. Other updates for the plan. Like I mentioned, we are pretty close with completing the framework. Now we're trying to find potential implementation partners. In the spring, we will be going out into the community to share the plan and get feedback. And then we hope to have a final plan by June 2025, where we will do a public release with the final plan and hopefully have an event by then. All right, next slide, please. A reminder to please help us spread the word on the work that we are doing. You can do that by sharing our media and marketing assets that you can find at inlandaging.org. You can also follow us on LinkedIn. We do posts, every other week. So please repost what we're posting, share your thoughts to help us spread the word. And if you're interested in having us present to your organization about the Master Plan for Aging, email us at info@inlandaging.org. All right. So now for our presentation on caregiving, Alzheimer's, and all other dementias. Sorry. So to get us started, I wanted to first share, like I previously mentioned, next slide, please, that November is National Family Caregiver Month, as well as Alzheimer's awareness. So I'll be talking a little bit about caregiving, and then I will turn it over to Susan, who will talk to you about Alzheimer's and other dementias. And so for the theme for National Family Caregiver Month is I Care. And so I do recognize that amongst us, we may have caregivers, right? So what I would like for you to do is type in if you are a caregiver and then complete that sentence, I care. I'm also a caregiver. I care for my son who has autism and cerebral palsy. So I'll start off by saying, I care patiently because it requires a lot of patience to care for my son. He's nonverbal. And so sometimes he has a difficult time communicating. We have a communication board with him. But even then, he gets frustrated. I get frustrated sometimes. And so I care patiently. And so if you're a caregiver, please type in there how you care. As service providers for the month of National Family Caregiver Month, we are encouraged to recognize and honor caregivers, raise awareness of the challenges caregivers face, provide resources and support to caregivers, and also encourage communities and organizations to get involved and to promote caregiver well-being. So as service providers, let's keep these things in mind this month and also the following months to take into consideration all the efforts that caregivers are doing on a daily basis, oftentimes without pay and also oftentimes with limited resources. Next slide, please. So to really think about the value of caregiving, it is estimated that family caregivers offer free services that sum up to 800 billion annually. That's a lot of money that they are saving our country. Approximately 15% of our population are caregivers. Okay. Again, a big chunk of the population in our country, also saving us a lot of money annually. So really, informal caregivers, family caregivers, I believe are the backbone of our healthcare system. They are the ones that are providing the care, making sure individuals take medications, making sure individuals attend their doctor's appointments, making sure that they are following the care plan that doctors are putting together. And many of us, we do it without pay, right? We do it because we step up. We do it because we love the person that we're caring for. And sometimes, there is no one else. And so we have to step up to provide that care. And so again, annually, informal caregivers that are not being paid are saving the country approximately 800 billion a year. Next slide, please. So to put this into perspective, I have here, some companies that we're all familiar with and how much they're bringing in annually. Apple at 385 billion, Amazon at 600 billion. Caregiving is surpassing all of these, which really puts into perspective the value of caregiving and how much money is being saved. And yet family caregivers, informal caregivers are not even considered when, we're trying to allocate resources and to create support services. Next slide, please. In California, there are approximately 5.5 million caregivers. So also a big chunk of our population. Caregivers are getting younger. 80% are under the age of 65 right now in the state of California. They're also a more diverse population. Over 50% of caregivers are in the workforce. So that's me. That's where I include myself, right? Working and also providing care. And I'm sure there's also many of us that are in this situation. And this is increasing, right? So over 50% of our caregivers in California are also working. There's also been an increased use of technology in daily transactions. And this was really prompted and pushed many caregivers towards this during the pandemic, right? When care providers were very, fearful of themselves getting COVID or the person that they care for getting COVID. And so they relied on technology to, request for medications, to attend doctor's appointments. And so really the pandemic pushed family caregivers to increase their use in technology. And even for our services at Inland Caregiver Resource Center, we offer a lot of virtual services now because of the pandemic, offering a lot of classes, offering a lot of support groups, and all through, the telephone or through Zoom, because caregivers are still even now fearful of going to in-person activities because of the spread of illness. Also through the pandemic, something else that increased was that caregivers are having to provide more skilled care. So what does that mean? Well, through the pandemic, they weren't able to take their loved ones to see the doctor. And so they had to rely on themselves to provide the skilled care that the person that they're caring for needed or required. So things like G tubes, making sure that they stay clean, giving shots or medications, changing. A lot of skilled care increased through the pandemic, and it continues even now. So definitely the profile of the caregiver in California has been changing over the years. Next slide, please. So what does caregiving look like in the IE, specifically in the Inland Empire? So I mentioned earlier that across the country, 15% of our population are caregivers. In the Inland Empire, it's projected that 16% of the population are caregivers, which is saving the state approximately 4.5 billion a year in free unpaid care. Okay, what is the population growth over the age of 65 plus mean for caregiving? I know we've showed this slide to you several times throughout our meetings, and we also have shared it in our conferences for the Master Plan for Aging, where the Inland Empire is projected to see a 682% growth increase in the population 65 plus between now and 2060. That's the largest across the state of California. And so what is that going to mean for caregiving? Well, that's going to mean we need more caregivers. And unfortunately, there are just not enough. So this is also something important to consider, and that we have been considering in the creation of our Master Plan for Aging. Next slide, please. So through our needs assessment that we've completed over the past 2 years in developing this master plan, We did make sure to include the voices of caregivers. We wanted to hear from them what they felt some of the gaps in services are currently in the Inland Empire. Okay. The quote here that says, individuals served as dedicated live-in caregivers to family only to have the family member die and their home be taken away, or they are paid so little they can't afford basic care as they age themselves. Okay. So we found that a lot, that caregivers, they provide the care, they stop working because they need to provide care. But then when the person that they care or that they care for passes, they end up not being able to afford, paying rent. And sometimes, unfortunately, they become unhoused. So some of the unhoused individuals that we spoke with during our needs assessment, that's how they became unhoused, because they were once caregivers and their loved one passed away, and so they lost the home that they were living in. Another important thing with regards to caregiving is the isolation that takes place. The social circles become smaller. Sometimes it's just one individual caring for the person with very limited support. Also, something else that we found was that caregiving can be very overwhelming. And so when you're trying to provide care and then also have to look for resources to help you, things become even more overwhelming. And so there's a lot of difficulty in navigating resources amongst family caregivers. But overall, though, something significant that we found through our needs assessment is that people value quality of life, right? When discussing extending life, it's important to discuss quality of life. So amongst caregivers, amongst older adults, amongst adults with disabilities, quality of life is extremely significant, and everyone in general, right? Because we are all aging. Quality of life continues to be a constant important thing that we need to consider, especially when developing a master plan for aging. Next slide, please. And so amongst diverse populations, what we found, there were some similarities and differences. Through our master plan, we asked questions to individuals from the African American community, the Latino community, Native Americans, LGBTQ community, unhoused, low income, people living in rural areas, and veterans. And when it comes to caregiving, we found some similarities amongst the populations, but then also some differences. Some of the similarities are the challenges. Challenges in finding the right appropriate care, similarities and challenges of trying to afford care in the home. Okay. Stuff that is working is the respite care, right? That is available by organizations that provide caregiver support services. Some of the differences amongst caregiving populations. We had a few men participate in our focus groups, and they mentioned how men can do caregiving as well. Although predominantly women are the ones that are providing care, men wanted to be acknowledged as also being able to provide care. Other challenges that we found, specifically among Spanish speakers, unhoused, African Americans, and even English speaking caregivers, is that caregiving can fall onto only one person. So again, highlighting the limited social support of family caregivers when they take on that role. Next slide, please. So even though the landscape of caregiving is changing, some of the needs of informal caregivers remain constant. The first being education about the illness that they're caring for, and also their need for education on the medical care the person that they're caring for needs. Emotional support is a big constant, with there being large numbers of individuals with depression who are providing care. Also the need for breaks, for respite care, taking a break here and there so that they can continue to recharge and continue to provide the care are some of the needs that remain constant. Also learning how to connect with resources and community support services. So through our needs assessment, we found that education and awareness is one of the main things that that caregivers and also adults with disabilities and seniors, older adults lack, is that they are not informed or not connected with the resources that they need in the community. So that increased need for education and awareness. And that's where we all come in. Next slide, please. Where we can all do better to help one another, to spread the word about the resources that there are available. One resource that is available across the state are the Caregiver Resource Centers. Caregiver Resource Centers were established into law in 1984. So since then, we have had resource centers across the state. Currently, there are 11 that focus on providing support to family caregivers. Locally in the Inland Empire, you have Inland Caregiver Resource Center. Next slide, please. That provides information and referral, family consultation, which is an assessment on the caregiving situation. Through this assessment, caregivers are helped to create a care plan. The care plan is not for the person that they care for. The care plan is for themselves. So we help individuals create a care plan that will address the challenges that they are facing as caregivers and address concerns that they are having as caregivers. And so that's a little different than a lot of other providers, right? That may focus on the needs of the person needing the care. So at Inland Caregiver Resource Center, we focus on the needs of the caregiver. We also provide supplemental services in San Bernardino County, which consists of assistive devices and minor home repairs, all focused on helping and making caregiving a little bit less challenging. In addition to that, we offer behavioral health services such as short-term counseling, prevention and early intervention programs such as PEARLS program to encourage active and rewarding lives in seniors, and also cognitive behavioral therapy. We have support groups. We also have educational workshops and conferences. And all of the services that we provide are free, thanks to support from state grants and county grants. Next slide, please. What's hopeful in the realm of caregiving, though, is that now there are so many other organizations also taking into consideration the needs of caregivers and therefore offering services for caregivers. And so I mentioned some of the county funds that we receive to be able to provide caregiver support services. These include funds from the Riverside County Office on Aging, specifically their Title III Family Caregiver Support Program, as well as the San Bernardino Department of Aging and Adult Services that also receives federal funds from the Family Caregiver Support Program. And then, of course, there are disease-specific organizations that provide caregiver supports, like the Alzheimer's Association, whom we will have here right after me to talk about their services. Regional centers also provide support to the caregivers of individuals that were born with a developmental disability, as well as the Veterans Administration is now offering caregiver support services. And so over the years, has definitely been an increase in organizations recognizing the need to support the family caregiver. And then most recently, CMS and CalAIM are trying to incorporate caregiver resources, recognizing that caregivers help individuals stay healthy. And then from our new administration, I hear that they are considering giving a tax credit for family caregivers, which would also be really significant in caregiving. Okay. So I'll go ahead now and turn it over to Susan, who will talk to you about Alzheimer's.
Awesome. Nice little segue with the Alzheimer's Association plug. Thank you, Carmen. And thank you everyone for being here. Um, my kind of present piece is pretty much going to follow kind of Carmen's outline as well. So starting with some numbers, I know that we're all feeling and seeing the increased number of individuals living with Alzheimer's disease or another type of dementia. So right now there are about 7 million in the US, and 10% of that 7 million actually live in the state of California. In California, of the individuals who are over age 65, about 12% are experiencing Alzheimer's disease or another type of dementia. Looking at Riverside, it's about 12.2%, so a little bit higher than average, and then San Bernardino, about 12%, kind of on par. What's interesting is Imperial County, so just a little bit south of us, actually is, I think, number 8 in the country of having a county with the highest prevalence of Alzheimer's disease and related dementia. So it is in our own backyard as well. We do know that right now about 1 in 3 older adults does die with Alzheimer's disease or another type of dementia, may or may not be diagnosed, and that Alzheimer's kills more individuals than both breast cancer and prostate cancer combined. So we're just trying to increase awareness about that. And historically, we've always thought everyone has equal opportunity to develop kind of cognitive impairment in later life. However, research is really starting to show that there are a lot of disparities that exist. So 2/3 of individuals who are living with dementia right now are women. Not 100% sure why. There might be some lifestyle factors. There have been some recent studies that look at reproductive health of women. I think it's also interesting to note that, pregnancy and number of children and number of miscarriages can influence cognition in later in life. So that really kind of encourages us to think about the brain and brain health across the lifespan, not just when someone hits a magic number of, 75 or 70 or 65 or whatever that number might be. We also know that there are racial ethnic disparities. So Black Americans are 2 times as likely, and Hispanic Americans are 1.5 times more likely to develop dementia than their white counterpart. Probably, again, a lot of different reasons around that, probably having to do with social determinants of health, as well as cardiovascular issues as well. Next slide, please. There are a lot of challenges around Alzheimer's disease, and they kind of run the gamut. This is still a disease, and cognitive decline still is stigmatized as well as not really well understood. The Alzheimer's Association produced a special report a couple of years ago and asked the average American, what were those early signs of Alzheimer's disease or even mild cognitive impairment? Again, changes in cognition that maybe are not normal. And no one could actually identify them. And then when these same individuals were given a list of, changes in cognition around memory, navigation, logic, reasoning, communication, what do you think the average American, kind of attributed those changes to? Just normal aging. This is not something that we see as a unique disease or kind of a pathology in the brain. It's just what happens to all of us when we get older. We also know there are a lot of challenges around not only diagnosing Alzheimer's disease and other types of dementia, but also just screening in advance. Another report looked at primary care physicians, and most don't feel comfortable or competent in doing an assessment and diagnosing someone with Alzheimer's disease in that primary care setting. And there's also this mismatch. So again, asking primary care docs, who do you think should initiate these conversations when a patient is showing signs and symptoms of cognitive changes? And the physician thinks it's the patient. However, when you ask the patient and the patient's family, their expectation is that their doctor brings up these points in the discussion. So again, a mismatch in whose role it is to actually initiate these conversations. Also with Alzheimer's disease, there are a lot of different behaviors associated with it that are also very difficult on both the individual living with Alzheimer's as well as that caregiver, whether it's a family member or paid. Some of these behaviors can include anxiety, sundowning, wandering, delusions, hallucinations, confusion, repetition, and even refusal of help from a family member. And it also brings up some of these behaviors, why individuals maybe are exposed to other industries and networks beyond kind of our senior industry as well. And then lastly, there's some unique challenges around services. The Caregiver Resource Center is an incredible resource. I think the biggest challenge is a lot of us don't know about what resources exist out there. I was recently talking to, actually, he was a captain in the LA Sheriff's Department, and he said, well, don't you have a regional center for all people with Alzheimer's? And I said, yeah, no, there's no centralized place where individuals can go and get assessed and have kind of a care plan created for both the individual living with dementia as well as the caregiver. And again, services are very fragmented and frequently out of pocket for individuals. Next slide, please. So we do know that caregiving is hard. We've all at some point provided care for another person, and it is physically, emotionally, just mentally draining. However, there are some additional unique factors for those who are caring for someone with Alzheimer's disease. So oftentimes family caregivers have twice the average out-of-pocket caregiving cost. They also experience higher rates of anxiety, depression, and also health-related issues. We hear so many individuals delay their own health in order to take care of their loved one. And we know that women take on more caregiving tasks than their male counterpart and care for people with more cognitive, functional, and behavioral problems as well. And these women often experience higher levels of burden, and again, that depression and impaired health than men. And women caregivers are also more likely to men to indicate a need for individual counseling, respite care, as well as support groups. Next slide, please. Again, just the impact on finances. The example that Carmen gave of a focus group member who mentioned that because of the caregiving and when the individual passed away, they became unhoused. So being a caregiver and being a caregiver to someone with Alzheimer's disease is expensive and has a tremendous impact on that individual's finances, from both out-of-pocket care or out-of-pocket expenses to actually having to step away or kind of reduce hours in the workforce, as well as creating and accruing more debt. So not only is this burden short-term, an average person with Alzheimer's lives 4 to 8 years, upwards of 20 years, but this is also a lot of the impact of Alzheimer's caregiving becomes cumulative because it is such a long journey. Next slide, please. There we go. So a couple of quotes from individuals. The first one, a husband of a friend got Alzheimer's. He's a big, tall man, and the wife is a petite woman. They're in their 70s. The wife is taking care of him because the cost of a caretaker is too much. She falls and breaks her hip. Later, he trips on her and she breaks the other hip. She couldn't afford to pay a vetted caregiver to take care of her husband while she was hospitalized. The caregiver stole valuables from their home. Probably a story I have heard multiple times. Another individual said, my daughter had given me some cards to hand out to people. My wife has Alzheimer's. Was interacting with saying, my name is X and this is what's going on. So again, having a way to communicate to others in the community when some of the behavioral issues were occurring. And again, most people don't realize that it's Alzheimer's or behavioral related issues. Next slide. So again, really looking at the focus group data, there's some similarities between all the participants who engaged in these focus groups, as well as some differences. Some of the things that are working is that, older adults can speak with their primary care physician if they do have concerns. Some of the challenges I've heard around that is that oftentimes people don't have a good relationship with their primary care physician, because that individual might change during each visit. Challenges, kind of general reluctance to seek support and expose oneself to wanting or needing help. I think that's probably a kind of a theme for caregiving in general. And most individuals thought about memory loss with concerns to others and not themselves. And I thought this was a really interesting finding, that I think because of a lot of the stigma and denial around cognitive decline with age, we often still don't internalize potentially those changes. And maybe it's denial, maybe it's lack of insight, maybe it's part of the disease process. But I really find that to be an interesting finding. Context, a lot of people use a lot of different words to describe memory loss. In English and in Spanish. And I think there is still a lot of confusion in the community about what those different terms mean. Alzheimer's versus dementia, the average consumer doesn't really know the difference. And navigating memory issues is very individualized. This is a process where the individual living with dementia, as well as their family caregivers, need to come up with their own practical tips and strategies to kind of keep that individual functioning at the highest ability that they are able to. Some of the differences, what is working, family can be a place of information or support, and senior centers are a place of support. And I think because Alzheimer's has such a broad prevalence, it is not just a certain segment of the population, and caregivers are everywhere. It's really important to identify that there need to be multiple points of support in communities that a consumer, how a consumer wants to digest information and support. Definitely kind of a really varied understanding of what causes memory loss, whether it's just kind of your average age-associated memory loss, or let alone, say, Alzheimer's disease. Recently, I was at a program I was in San Bernardino, the city of San Bernardino, and a woman told me that Alzheimer's was because her family member used a metal pot to cook all of their meals, which, maybe that could be right, but probably not. So how do we provide accurate information? Aging unhoused individuals experiencing memory loss and dementia have little resources. And that has been kind of a growing trend within California, that individuals are becoming unhoused after age 50 for the first time. And a lot of the risk factors associated with living on the streets or in an unhoused situation also increase the risk factor for cognitive decline in later life. And then one of the challenges, aging adults can volunteer with youth, but not much discussion is on the mental benefits of volunteering. And there's been actually some research around that that's actually really positive as well. Next slide. So what I kind of wanted to talk on are, how are we kind of shifting some paradigms here? Historically speaking, Alzheimer's disease tends to be, we don't feel very empowered. We feel powerless. There's no cure still. However, I think there's some really important trends that are occurring that I really just wanted to highlight. One is, how do we shift this conversation from something that is just in that aging network bucket to something that is more of like a public health issue? So public health issues, they are substantial. The prevalence and costs are significant, which we're seeing with Alzheimer's disease. The impacts are serious. And there are existing solutions that are available. So some of those solutions could be promote brain health. Right now, about 2/3 of adults have one or more of the 5 major risk factors for dementia. And that would be, physical inactivity, hypertension, diabetes, obesity, and/or smoking. And how can we use these public health approaches to help communities find ways to increase healthy behaviors? Another solution is increasing access to early detection and diagnosis. Over half of adults reporting subjective cognitive decline have not consulted or talked to their healthcare professional about that. And right now we are in this new era of treatment where there are medications available that can they actually remove the plaque from the brain of someone with Alzheimer's, which actually kind of halts that cognitive decline, as well as has significant functional benefit to that individual. And then last solution is, how do we support people living with dementia and their caregivers? Right now, an estimated 65% of older adults facing dementia live at home or in the community. And I think that's probably a low statistic. And about a third of those caregivers report worsening health as a result of their caregiving duties. So one solution could be increasing community clinical linkages through public health approach that can ensure caregivers are identified and have access to supports and services to care for themselves as well as their care partner. Other things that I think are really kind of positive and on the horizon is Riverside University Health System, who I know is present here on this call, was recently awarded the Healthy Brain Strategist Program. And so that will be looking at creating strategies that are community-based around engaging in healthy habits for our brain. Something else that's on the horizon is just this concept of dementia care navigation. So it's comprehensive personalized support for individuals living with Alzheimer's disease, as well as their caregiver. And it really is based on the idea of how do you provide the right care by the right people in the right place at the right time. So this was created through the Center for Medicare and Medicaid Services in 2023, and it's a guide model. And basically, it's being piloted in Missouri, Illinois, Texas, Washington right now. And I think the next wave of expansion will be to California. But it's how to create an innovative care coordination approach to improve the quality of life for people living with dementia and their family caregivers, and really helping them to remain in their homes and communities as long as possible. So during this pilot, CMS will introduce actually a new payment model for dementia care navigation services. So that's kind of a really exciting piece that's coming along. Other things, kind of the role of risk reduction. I think historically we've kind of thrown up our hands and said, if it's meant to be, it's meant to be. But a lot of the research right now is looking at healthy lifestyle behaviors that we can engage in that will benefit our brain, not only in the short term, but in potentially 20, 30, 40 years as well. And expanding dementia capacity within existing systems. So at the Alzheimer's Association, we do a lot of work within health systems to really build the capacity of primary care to evaluate and diagnose individuals with Alzheimer's disease, as well as manage their ongoing care, and creating positive pathways within health systems for these families. Next slide. So other things we do at the Alzheimer's Association, our whole purpose really is to reach more individuals and funnel them into the existing services, and then finding where those gaps are and help building that dementia capacity. Probably the most useful service we have, actually they're all useful, sorry, is our 24/7 helpline, and that's answered in over 200 languages. And it is at no cost to individuals, but it's everything from, I need a support group, I need a class, I need a neurologist, to handling those heavy questions at 2 a.m. I can't take it one more day. I am completely overwhelmed. I am done. And so we have master's level clinicians who can create some short-term planning for individuals. We do education support groups. We have some early stage programming as well. So individuals who are diagnosed often state that their friend circle kind of disappears. So we create social activities for these individuals so they can almost like lead a normal life and have social interactions, cognitive stimulation, maybe physical outings as well. We do, again, a lot of education and awareness. I think we're all tired of hearing family members say, I'd only wish I'd known about your service 3 years ago. So how do we get to them before that? Talked a little bit about research, health systems. We do significant amount of research. We fund researchers and we lead research. And that's really, I think, an exciting area. And then we advocate for improved policy at the federal and state levels as well. So next slide, and I think Carmen, you and I are going to kind of share the next couple slides.
Yes, thank you. Thank you, Susan. That was awesome information about Alzheimer's and some of the neat things that are happening now, and also how we can kind of prevent, right, through healthy lifestyles and healthy changes. And so before we move on to the focus areas that the master plan for aging it has put together, does anybody have any questions that they would like to have addressed regarding, the information that Susan shared or the information that I shared so far? If you do have questions, please put them in the chat. Yes, we will send you that contact information. So Dakota is asking for your contact information, Susan. And so, Susan and I, we shared some of the findings from the needs assessment that we've completed in developing the Inland Empire Master Plan on Aging. And we do have a goal that focuses on caregiving and Alzheimer's disease and other dementias. And so the first strategy that we have 3 strategies that we'll be addressing both. And the first strategy is long-term care. And so the 2 objectives in this area are to increase awareness among providers and consumers of long-term care services, but then also to support the capacity of long-term services through advocacy efforts. And so as we go through these different strategies and objectives, this is where we want your help, right? Because we're developing this plan. These are the objectives that we're putting together, but we need to implement them and we need partners. And we know we have a lot of organizations here today, including Riverside University Health Systems and some other nonprofits. And so we want to include you, allow you the opportunity to be a part of the solution with some of these challenges that we've both shared amongst caregivers and amongst families and individuals with Alzheimer's and other dementias. And so one of the big things that we keep talking about is increasing that awareness, right? And so if you see yourself or your organization fit into any of these, please let us know so that we can include you as a potential partner in these efforts. Next slide, please. And so the second strategy focuses on caregiver support. And so that is the 3 objectives that we have here are to ensure that family and friend caregivers are aware of resources and how to access them. And so like Susan, we also come across a lot of families that say, if we had known about your resource sooner, or I used to care for my mom, I wish I had known about you when I cared for her. And so that, is a collective effort. ICRC is a nonprofit organization. And so when it comes to, do we pay for marketing or do we pay for more respite care grants, right? We're going to go to try to pay for more respite care grants. And this is so where all of you can be involved in sharing the resources that are available in the community, like Alzheimer's Association, like the Caregiver Resource Centers, to connect families with those resources. Once you identify that a caregiver or an individual with Alzheimer's and dementia may need assistance. The second objective here is to connect providers with caregiver resources. So that's kind of what we're doing today, right? We're sharing with you information about what our organizations do, also giving you information about the clients that we're serving, so that if you yourself need the services or if you come across individuals in your professions that may need our services, that you connect them with us, right? And then C, to incorporate caregiving into considerations into housing, behavioral health, and transportation activities to strengthen caregiver support. Because really caregiving is in all of these different domains, right? We mentioned about the examples with housing. After someone provides care, they lose their home, they lose that extra income, and so they become unhoused. How can we work together as a community to prevent that from happening? Or when it does happen, how can we support that family to transition back into getting housed? Behavioral health. I mentioned about, family caregivers and informal caregivers having high rates of depression, and about socialization circles decreasing once you start providing care, right? So we need to make sure that we include caregiving into behavioral health support programs, and we consider the caregiver. We ask, a lot of, like I said, a lot of service providers focus on the person that needs the care, but we need to also start asking questions of the person providing the care that is bringing them to those appointments, or that is advocating for them. And then, of course, also in transportation. And when I think of transportation, a lot of our systems that are put together in place, they may not take into consideration the needs of caregivers, adults with disabilities, or seniors. And I can give you an example, if you're caring for someone with Alzheimer's and dementia, it's going to be more difficult for you to use public transportation with that individual, because there's a lot of different noise. There's a lot of different, walking distances from the house to the bus stop. And so those types of transportations may not be appropriate. So how can we help our transportation system to incorporate the needs of individuals with Alzheimer's and dementia, as well as caregivers? So if you're interested in helping with any of these objectives, again, please let us know if you have ideas, or if you have services already that we could include you in. Send us out an email so that we can do that. Do we have a third slide? I thought we had a slide specific for Alzheimer's.
I think we did. So I can just kind of talk a little bit about it. So we do have a third strategy around Alzheimer's disease and dementia. The objectives would be, first, to build dementia capacity within existing systems. For example, home care, care facilities, law enforcement. So it's also looking at, we don't, as I'm overly confident, but I do recognize I don't know everything. So it really is looking at the bigger picture, like what are these systems that need kind of some bolstering around dementia capacity, and also what currently exists and what's currently working. We don't always have to recreate the wheel. There's like a small pilot, maybe we could expand that. The second objective is build public awareness and education on early detection, diagnosis, and treatment. There are a lot of existing tools. California Department of Public Health, has a Take on Alzheimer's campaign that's available in English and Spanish. So again, there's some tools that exist, but how do we leverage them? Ideally in kind of less expensive places as well, at no cost. So I think all of you have ideas and know about these different systems and different things that exist and what may reach different segments of the population. So again, we would love your input and participation in any and all ways.
And so once again, send us an email. I have the email wrong on here. It should be info@inlandaging.org, not .com. If you're interested in participating or helping us out in implementing some of these objectives and strategies, Susan and I will be hopefully co-chairing a subcommittee that will focus on making sure some of these things are implemented in the Inland Empire. And so if you want to be a part of that, please let us know. And then finally, our next meeting, we will not have a meeting in December because of the holiday. Our next meeting is going to be Tuesday, January 28th from 11 to 12. So, if you haven't registered for that meeting, please do so. Everybody have a happy Thanksgiving. And if we don't see you, also have a happy Merry Christmas and a New Year. And we will see you next year. Thank you all for joining us today.